Water fluoridation, hailed one of the greatest health achievements of the 20th century, proven to prevent tooth decay.
Children of today have 1/3 the number of cavities that children had 12 years ago.
200 million Americans live in communities that put fluoride in its tap water, and almost every toothpaste has fluoride in it.
Superior fluoride toothpaste.
Officials touted its benefits while cavity rates across the country fell. But unlike toothpaste, which is not swallowed, there were always skeptics when it came to drinking water.
Fluoride is a toxic chemical. In large doses, it's a rat poison.
The anti-fluoride movement, once seen as a fringe, misinformed effort, is now gaining steam as more research is done. Some communities voting to remove it from their drinking water.
The county commission voted 3-2 to remove it.
And now a win in court for those wanting more oversight. A federal judge ordering the EPA to further regulate fluoride in drinking water. The determination stemming from a U.S. government report from the National Toxicology Program concluding that fluoride at 1.5 milligrams per liter, twice the recommended amount in drinking water, is linked to lower IQ levels in children. The study was based primarily on data from non-U.S. countries, including Canada, China, and Mexico, getting higher levels of fluoride. But it also found that about 1.9 million people, or less than 1% of the U.S. population, are getting naturally occurring fluoride at levels of 1.5 or higher. Judge Chen writing in his ruling that while it's not established fluoride levels in U.S. water is causing lower IQ in kids, the EPA still must act, saying, and I quote, "Simply put, the risk to health at exposure levels in United States drinking water is sufficiently high to trigger a regulatory response by the EPA."
The federal ruling stated there's not enough of a margin of safety there.
Dr. Ashley Mallon is a researcher and professor at the University of Florida and has studied the effect of higher fluoride levels in pregnant women.
Since 2017, there have been several rigorously conducted prospective birth cohort studies in North America showing that fluoride exposure during the prenatal period has been consistently associated with reduced IQ in children.
The EPA has argued it isn't clear what impact fluoride exposure has at lower levels.
I think it's advisable at this stage that pregnant women reduce their fluoride intake and that they are vigilant about reducing their baby's fluoride intake after birth as well.
Federal drinking water standards that included fluoride guidelines were first set back in 1962. Since 2015, officials have recommended a fluoridation level of 0.7 milligrams per liter of water. Before that, the recommended upper range was 1.2. The WHO has set a safe limit of fluoride in drinking water at 1.5.
There's a lot of methodological concerns about those studies that have come out recently.
Dr. Charlotte Lewis, a professor of pediatrics at the University of Washington School of Medicine, thinks eliminating fluoride from drinking water could be a huge step back for health care.
Our concern is that the judge did not understand that for every mineral out there, whether iron, calcium, whatever, if you have too much of it, it's toxic. If you have too little, you're deficient. And the same holds true for fluoride. So at the level 0.7 parts per million, which is what we have in our water supply, that's never been looked at in a population-based study to see whether or not that affects IQ.
The EPA issuing a statement saying in part this: they are reviewing the decision and that it currently regulates fluoride at higher levels. As it seems the battle over the tap is just heating up. Yasmin Vossoughian, NBC News.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.